My name is Cheryl Lummis, and I'm a clinical nurse specialist and a certified diabetes educator at SSM Health Cancer Center in Mexico, Missouri. I've been a nurse for 20 plus years, with 18 of those years being at Audrain Medical Center, now SSM Health. I've been a staff nurse, a diabetes educator, and most recently a hospitalist after receiving my advanced practice degree as a clinical nurse specialist. As of May 1st, I joined the wonderful group at the Cancer Center in Mexico and the Radiation Clinic in Jefferson City. First, I would like to just say, praise be to God. I was surprised and completely humbled by the nomination to be a keynote speaker, and was at a complete loss as to why I was chosen and what I had done that would make someone want to nominate me. I became curious to know what someone had to say about me that would make the committee choose me. I'm amazed at what I read and thought to myself, I'm just following Jesus. And when he stated in Matthew 22:37-39, love the Lord your God with all your heart, with all your soul, and with all your mind, and love your neighbor as yourself. I was doing my job. I was being Christ-like, treating others and their loved ones as I would want myself and my loved ones to be treated. I didn't feel worthy of this nomination, but I'm so very honored, and thank you for this awesome invite and experience. Recently at a retirement reception, Brent Vanconia stated, "Healthcare is a calling and a ministry." These words resonated with me, and I began to reflect back on my career and how I ended up where I am today. My journey into nursing started when I became a respite volunteer for a hospice agency in my hometown. It was there I knew that God was nudging me into my calling and my ministry. Over the years, I've been allowed by God in my place of employment to cultivate my passion and ministry for those who are sick and hurting. Many times I have cared for patients and family members who I knew were not going to get better, but I knew I could pray for them and with them. I tell people I may not know what to do or say, but I know how to pray. Romans 8:26 states, in the same way the Spirit helps us in our weakness. We do not know what we ought to pray for, but the Spirit himself intercedes for us through wordless groans. For 90 plus years, my facility, AMC, was a standalone county hospital. However, like all small hospitals, times were tough. We began to struggle financially and most of all spiritually. Administration regretfully made cuts and morale was low, to say the least. Two colleagues and I began meeting to pray for our institution's issues. As stated in Matthew 18:19-20, truly I tell you that if two of you on earth agree about anything they ask for it, it will be done for them by my Father in heaven. For where two or three gather in my name, there am I with them. Our prayers were heard, and SSM Health was the answer. It's been wonderful to work for a facility where prayer and reflection is a part of our daily routine. Many times I have prayed with or for my patients and their families. I truly believe these prayers, all our prayers, have the ability to have an impact. Recently, a young man in his late 20s was attempting to come to our emergency department. And I will add here, he was in Colombia and drove back to Mexico to our emergency room department. He almost made it, but became ill and turned into one of the parking lots. When he opened his truck door to vomit, he went unconscious and fell out of the truck. A code was called. It was the end of the day, and I was preparing to leave. But God had other plans. When I got to the scene, CPR had been started and EMS had been called. The young man had to be shocked because his heart went in VTAC and then it stopped. When they brought him into the ED, the unit clerk was extremely upset. I asked her who the patient was, as I never got his name. She explained it was a dear friend of hers and his wife was in the waiting room. She asked if I could go be with her. I ran to the waiting room and found that I knew his wife as well. She was understandably extremely upset. I just looked at her and said, I don't know what to do except pray. And pray I did. Holding her hands in mine while praying, I felt a calm come over her. When we opened our eyes, There were many people standing around to let her know her young husband was going to be okay. God was listening, and he is so very good. The young husband just went back to work and is doing well, and I just recently got to see them, and he is doing wonderful. I find it ironic I was asked to talk today because I've been struggling with whether I'm really where I need to be. Am I doing what God really wants me to do? Am I making a difference? Is God using me to further his kingdom? It's so hard for us to see what others see in us. And then I get this nomination, and I read the letter, which was from a coworker, a friend, and a patient, who spoke about our first encounter in the 90s. I don't remember this encounter, but it was when her father-in-law was dying, and I prayed with him. The same coworker shared that when she was a patient of mine, she was going to have to start insulin, and she was afraid, and we prayed, and she's not afraid to take insulin. I don't remember that instance either, but I'm so humbled to know that I can make an impression and a difference without realizing that it's happening. After reading this nomination, I know that I'm right where I belong, helping those in the past, present, and future become stronger physically and spiritually, one patient or family at a time. They say sometimes we come full circle in life. I started my nursing career as a nurse tech working in hospice, caring for those at the end of their life. Now, as an advanced practice, I'm back to helping those with a new diagnosis of cancer, living with cancer, and sometimes even dying with cancer. Sometimes I'm at a loss as what to say or do, but the one thing I can always offer is a prayer and my passion for patients, their families, and the Lord. Again, I want to share words of Brent Vanconia. Healthcare is a calling and a ministry. Healthcare is my calling and my ministry. Thank you.